Good afternoon and welcome. I am thrilled to welcome you here. My name is Niteesh Choudhry. I'm a professor at Harvard of Medicine and Public Health, a physician at the Brigham and Women's Hospital, and one of the co-PIs of the Massachusetts AI and Technology Center. And on behalf of our center and the entire collaboratory that we call the A2 Collaboratory, we're pleased to welcome you to our third annual meeting. So the AITC program is funded by the National Institutes on Aging, and it supports 3 centers. Ours is a collaboratory of 5 different Massachusetts institutions. It's centered at UMass Amherst, but involves Brigham and Women's, Mass General Hospital, Northeastern, and Brandeis. And we are joined by our sister centers from Johns Hopkins and Penn. And the collaboratory seeks to identify, fund, and foster promising AI-driven age tech projects that aim to improve the care and health outcomes of older adults, including those with Alzheimer's disease and related dementias. We'll spend the next day and a half talking about issues that are core to the initiatives that you are all involved in and that you care about profoundly. Specifically, this afternoon, we'll talk a little bit about tools to assist with cognitive impairment, tomorrow methods in machine learning, and then the data that we use for all of these activities. We are thrilled to bring together such a diverse group of people. So you are, just to label the diversity in the room, entrepreneurs, academics, computer scientists, engineers, clinicians, patients, caregivers, administrators and health organizations, government officials, funders, and many other things. And you come from 29 states, and some of you have traveled internationally to be here. 65 of you are past or present A2 awardees. And even more importantly, 70 of you are not affiliated with an AITC program. And so from that perspective, while we think the content of what we're going to talk about today and tomorrow, the formal programming will be of exceptional interest, what we think the real value of a meeting like this is for you to be able to spend time with each other, for you to meet each other, and for you to meet us and us you. And so we hope you'll take opportunities of the less structured parts to do precisely that. I'd like to, before handing over to the next parts of our program, I'd like to make sure that we acknowledge our sponsors. So this event, of course, is supported by funds mostly from the NIA, but Samsung Health is our platinum sponsor and helped defray a number of our costs. In addition, the Mass PACE and the UMass LIFT program were also responsible for providing support, as well as the Research Center's collaborative network of the NIH, which provided travel funding for some of our attendees. I'm now pleased to introduce Rose Lee, who's co-PI of the Coordinating Center for our A2 collective. Rose.
Thanks very much. I'm delighted to be here to add my welcome on behalf of the AITC Coordinating Center. One of our core functions is to publicize and manage the annual pilot competition. And over the last 5 competitions, we've received over 1,200 applications. We're expecting to fund at the end of it about 160 awards. That represents about a 13% success rate. So it is a hard journey for the people who have received them. But I point out that this success rate is even more restrictive than an SBIR. This represents a very select and impressive group who now have the opportunity to access mentoring and resources from the AITCs, and will position these pilots to be able to accelerate innovations that they're developing, bring it to market, and to be positioned to engage in meaningful investments with venture funds and also through the SBIR, STTR pathway, where scientific rigor and commercialization potential are key considerations. We really want to give thanks to the AITCs, the external advisory panel members, speakers and panelists, funders and deal makers, as well as the A2 pilot awardees who have all contributed to this year's fabulous programming. Mass AITC is our local host who secured this beautiful space for the meeting. And we all know we're doing really important work, but I think in this impressive building, it makes our work seem even more important. I want to thank our platinum sponsor, Samsung Health, especially its digital health team, for their generous support and collaboration. Also want to acknowledge travel support to early stage investigators provided by the NIA-sponsored Research Centers Collaborative Network and additional support from Mass, PACE, and others. And of course, NIA for its really inspired initiative and coming up with this idea to fund this program, and which began more than 5 years ago before the splash from ChatGPT and generative AI became a thing. So we're thrilled to be here and looking forward to a great experience. Thank you.